So my name's Jacqueline Del Bravo. I'm the Workforce Development Coordinator at Hepatitis WA, and I'm here with my colleague Donna Garcia, who is the Needle and Syringe Program Coordinator at our office. Before we start, I'd like to acknowledge the traditional custodians of this land, especially the Pinjarra people from where I am in Mandurah, whose lands I'm on today, and acknowledge and pay my respects to elders past, present, and also future elders. So Hepatitis WA, if we haven't heard of us, we've been around for 30 years supporting people with bloodborne viruses, particularly viral hepatitis. We have a range of services. We have a confidential helpline that's also accessible from inside all prisons within Western Australia. We also have a primary healthcare clinic. We do a whole range of education and workshops, and we also have a needle and syringe program that Donna's going to talk about more in depth later. So we're there in Northbridge, just next to Russell Square, very central. That's our new clinic. It's the Dean Clinic. You can see Donna modelling it. It's brand new. And we have a range of services that we do. We do testing and treatment for viral hepatitis, and we also do vaccinations. We do sexual health, screening, PrEP, etc. General health, everything is bulk billed. You can make appointments, or you can also just walk in. We have a GP and a nurse on staff. Just want to take you through viral hepatitis really, really briefly for people who may not have seen my prior presentations. So in Australia, we have three types of viral hepatitis: hepatitis A, B, and C. Hepatitis A method of transmission is fecal oral, that's literally poo to mouth. Good news is it's vaccine preventable. And the other good news, it's 100% clearance rate. So people who get it after a few months, they will clear it naturally. And after that, they'll have immunity. Symptoms are nausea, diarrhea, fatigue, fever, a little bit like gastro. Then we've got hepatitis B. Now, this is when we get to the bloodborne viruses. It's also in sexual fluids. Good news is it's vaccine preventable. Adults, if they're exposed to the virus and they haven't had the vaccination, 95% of adults will go on to clear it, but 5% won't, and they will have a lifelong case of viral hepatitis B. Children, if they're exposed to the virus, 70% will go on to clear it naturally, but 30% will have a lifelong case. And infants, only 10% of them are able to clear it, and 90% go on to have a lifelong case of hepatitis B. That usually happens during the birthing process, so vertical transmission. There's no cure for hepatitis B, but there are very good treatments. Globally, it's a huge issue with 296 million people living with hepatitis B. Hepatitis C is another bloodborne virus. It's in blood only, so it's not in sexual fluids, so it's not in semen and vaginal fluids, it's only in blood. There's no vaccination for hepatitis C, and there's no immunity to hepatitis C. So if an adult is exposed to hepatitis C, and 25% of them will go on to naturally clear the virus, but afterwards they won't have immunity, so they can get it again and again and again. There is a cure available, really effective. With 3 months of taking daily medications, 95% of people are cured of hepatitis C. But again, there's no immunity. So if you're exposed, you can get it again and again and again. Also, HIV is a bloodborne virus. And in Australia, we have approximately 29,000 people living with HIV, increasing by approximately 900 people a year. Hepatitis B, 230,000 people, approximately going up by 7,000 people a year. And hepatitis C, currently 130,000 people, and that increases by about 10,000 people a year. About 4 or 5 years ago, before these new treatments came on board, we had 230,000 people living in Australia with hepatitis C. Luckily, about 100,000 people have been cured. Now, the big news with hepatitis C is that 91% of new infections of hepatitis C are the results of people sharing injecting equipment. And that's where we come into how relevant harm minimisation is when it comes to bloodborne viruses. So Australia's national drug strategy since 1985 has been one of harm minimisation. It's a three-pronged approach. So there's supply reduction, that's about policing, legislation, border patrols. Then there's demand reduction, that's detox, rehab, education, etc. And then we've got harm reduction, and that's needle and syringe programs, otherwise known as NSPs, and also opioid replacement programs. So the Australian National Drug Strategy doesn't condone drug use, but it accepts that drug use exists, and its aim is to reduce drug-related harms to individuals and also to the community. So needle and syringe programs provide access to sterile needles and syringes to people who inject drugs. We can also, at needle and syringe programs, offer safer injecting equipment like swabs, waters, filters, etc. Also disposal and collection of used injecting equipment. We also provide education and health information. Sometimes there's primary care attached to a needle and syringe program, and referrals to other services, health, medical, legal, etc. So it's one of the main strategies that we have in Australia to prevent the spread of blood-borne viruses among the injecting drug user community and also the wider community. Our first needle and syringe program began in Sydney in 1986, and these days we have over 3,000 outlets. Pharmacies are heavily involved in needle and syringe programs, and needle and syringe programs are legal and fully funded by the government. So there's different types of needle and syringe programs. So there's primary outlets. That's where needle and syringe exchange programs are part of their core business. And what that means with the exchange is a person would go in, purchase an amount of equipment for a low cost. There's different sizes of barrels and syringes that people can purchase. So approximately 25 cents for a barrel. And about 10 cents for the tip, so for the syringe. Then once you've used it, say you purchased 100, you take it back, you dispose of it, and then they will exchange and give you a free new 100 syringes. So they also provide injecting equipment and other, sorry, my phone's going off, whoops, which is on my wrist, which was freaky, sorry. So secondary outlets, we are a secondary outlet at Hepatitis WA, also population health units, emergency departments, community health centres and nursing posts are also classed as secondary outlets. And we provide free fit packs to people, so there's no cost, but there's a limit on the number of fit packs that can be obtained at the one time. Just a little bit of a breakdown of where needle and syringe programs are mostly used. So you can see the sort of tan colour, that's pharmacy. So that's people going into pharmacies and purchasing a fit pack. And I'll show you in a minute what a fit pack looks like. So that's where most people are actually obtaining their syringes. Then we've got vending machines, so that's a smaller amount of people will be using vending machines. Then we've got secondary outlets like ourselves at Hepatitis WA, and then primary outlets in the black colour. This is a fit pack that a person would purchase from a pharmacy. This is the Fit Pack Plus, so it's got some water, it's got some swabs, it's got some spoons and 3 syringes. Or you can get a fit pack and it's just got 5 syringes in. And that's what you would obtain from a pharmacy, and that hard case is where you would dispose of the syringes after you've used them. $10 usually is the cost for a fit pack if you're going into a pharmacy. In regional Australia, there's a WA Health Directive that states that syringes should be available for people in regional WA outside of the hours that local pharmacies are open. And also some of these emergency departments will have vending machines attached to them as well. And there's a link that I will also put in the little messages box, so you can see that you can find out where all needle and syringe programs are in WA. If you go down this list, so you can see what, for example, peer-based harm reduction do. They have their fixed needle syringe exchange sites, then they have some regional ones, and they also have a mobile clinic where they go to different areas. Yeah, you can look at what pharmacies are involved in the program, what regional hospitals and health services, where the vending machines are. So you can go through and have a look. I should show us as well, where they're as well on that list. So I will include that in a link. So the benefits of having needle and syringe programs in Australia are vast. If you look at other countries where they didn't start needle and syringe programs, HIV rates are much more prevalent among people who choose to inject drugs. In Australia, it's about 1% of people who are injecting drug users have HIV infection. In other countries that don't have or implemented needle or syringe programs quite late, have over 50% of injecting drug users currently living with HIV. These are some financial benefits of needle and syringe programs, so the community benefits. So it's very old data, but it's the latest data I could find. So from 2000 and 2009, needle and syringe programs have avoided 32,000 HIV infections, 96,000 hepatitis C infections, and that's resulted in 1.28 billion saved in healthcare costs alone. So if you think that was back in 2009, so today the amount of money that's been saved in healthcare costs through needle and syringe programs would be much, much more. All right, I'm going to pass on to my colleague Donna. There's a photo of Donna leading us into the needle and syringe program at Hepatitis WA.
Okay, hi, my name's Donna Garcia. I'm a Torres Strait Islander lady that was bred here in Perth. I'm the needle and syringe coordinator. I'm also the Aboriginal liaison officer here. So this is the front of our NSP, and then we'll go through into the NSP. When our clients come in, first I'll tell you about the opening hours for our NSP is 9 to 4:30. We have volunteers man the front of the NSP in the reception area. They do 4 hours for 2 shifts, so we have 2 volunteers per day. And part of their job is to making up the fit packs, which I'll show you later what our fit packs look like. The maximum a person can get per day is 25 needles a day, so that's 5 packets. Also have other injecting areas. Also the link that lovely Jacqueline showed us with on the health website, there's also a link that we do postal. So we have a lot of country mob that will come down. That they get up to 50 fit packs to take back, but if they can't get down to us, we'll post it to them. Because of COVID, the health department brought out that a lot of people couldn't get into the city, so peer-based ourselves and WAC were able to do postal, so we've kept that postal thing going, and you can find that out on that web. Yeah, and we do naloxone, so I'll get to the naloxone properly, but yeah, we give away the naloxone. We give naloxone. We do the education around it, and we have other equipment to do with injecting. Okay, Jacqueline. Okay, so this is when you enter our NSP, this is what you see. We like kind of greet our clients with food, try and con them in, and then so we can get into talking to them. So they'll help themselves, then they're greeted by us. This is my colleague Pete. Unfortunately, a volunteer wouldn't get a photo done, but yeah, you'd be faced with a volunteer there. And yeah, go to the next one. So this is our is what volunteers make up. So we do the flyers that you see down the bottom. We do 2 flyers per month. Like, we try to include everything. More pictures, less words. Even though there's a lot of words on these ones, I've changed them up since then. Every flyer, the volunteer will tell the client about what the promotion is for that day. So just for an example, with getting rid of your used bits, they will demonstrate to them that if they take it off, put it in the sleeve, lock it in there, they'll show them that no one can use it again, and that can be put into a bin. They don't have to look for a discarded bin. They can put that in the local bin. So landfill. The flyers are wrapped around the swabs. So they get 2 swabs per needle. So the flyer's wrapped around it. So they've got no choice but to look at the picture. So we here at Hepatitis WA, most of our clients are street-based. So we find that they understand a picture more than what they do with words. So that's how we do it. Also, they get water, injecting water in spoons from us. But our actual fit packs only come with the 5 sleeves, 5 needles, the 10 swabs, and a cotton ball. And we let them know, don't use a cotton ball, or it's not sterilised for filtering. Yeah. Okay, so like I was saying about the flyers, we will talk about like World Hepatitis Day coming up, and about getting retested, tested, safe disposal already mentioned, mental health, sexual health, well, hepatitis. We acknowledge NAIDOC Week and Reconciliation Week. Also, we do promote the overdose because of the strong impurity of the heroin on the street. So opioids, we have naloxone on hand. We don't know who is on uptown or downtown, so we try and just get it out to everyone, especially with COVID, drugs getting mixed up. Be careful what you're using. Always have naloxone on hand. So we really push for the naloxone to go out to anybody. Acknowledging NAIDOC Week, we will do the flyer for that week, but at the same time, we don't want to discriminate and say that it's only black fellas that inject drugs, if you get what I'm saying. Yeah. Okay. Jack. So we do referrals. We'll get once the client started to us, like they get used to, our volunteers will get used to our clients. A lot of them come in, they call me auntie. That's because I've been here since 2017. They know me now. Once they feel confident to talk to us, we will, I'll then approach them again about, have you been tested lately? Have you been at risk? We'll get them through to the clinic. If they're still uncomfortable to go through the clinic, I can follow them through for them. A lot of our street-based people can't understand the language coming from a doctor, so they feel more comfortable if I'm in there and I can explain it to them in a way that they understand. And then, yeah, we've seen that's working like that for us. I follow the clinic coordinator out to the outreach clinics, such as where there's other, and we'll just table and have a yarn with them, get their bloods, and then get them into the city, into their office. So I enjoy doing that. Yeah. Okay. So this is our statistics. We don't ask them no questions. Don't ask them their age. Not he, she, nothing. We don't ask nothing. We just look at them by the eye without judging them. Well, really, we are judging them, and we put our own stats in. As you can see, I'm just showing this back in Jan to June 2020, just to show how the drop was because of COVID, if you can see that. So there was since 2017, since I started, our Aboriginals are like, we're even across the board now, non-Aboriginal and Aboriginal, but the drop during COVID it was yeah, really it dropped a lot. Okay, next one. So, and the age range, the same thing. This is during COVID. So mainly people in there over 26 we see, but we do have a few young ones. Okay. And of course, the gender, we only have the two genders, male and female, and that's pretty much even as well. Well, we've got more males attending now. Well, when I first started, it was more females. So yeah, we get more males coming through the door. Yeah. Is that it?
Yep.
Okay, any questions?
Are there any questions from the chat room for the people we have? I don't think there's a lot, but
I have a question.
God, Helen has a question for Jacqueline and Donna.
Yeah, I was actually just wondering if you guys have noticed an increase in the naloxone that has been given out during COVID. Has that increased it at all?
Donna,
I didn't get that.
have we seen more people coming in to get
It broke
naloxone?
up. Yeah, most definitely. Yeah. Yeah, since COVID, yeah. So you get to know your street dealers and that, and they you force you what they've got, which is great to us because then we know what they're mixing. And we know, okay, look, all these guys they're used to going uptown, but they're actually taken downtown. So then, yeah, during COVID, naloxone went haywire out the door.
Is that for more people using opioids during COVID because there wasn't much access to methamphetamine?
There was not, yeah. The border's been shut and that they've had to change their choice of drug. Yeah.
Amazing. Was there any other questions in the room? No, we'll take that as a no. I think I do have just one question, especially seeing the graphs. That was very interesting, and I hope I'm not cutting too much because I know I'm having some tech issues on my side. Yeah, with those graphs, in terms of those, have you, was there any difficulties in terms of promoting the program, especially, you know, surrounding the stigma of using drugs, of needles, that we know in the mainstream media is quite, you know, it's been blocked out. Have you encountered difficulties, or have you came up with like really good interventions in promoting it, all that, etc.?
So if I go out and I do an education around bloodborne viruses, I choose when and where to use injected equipment. So, for example, if I'm out of school, I won't mention it. I'll lean more towards backyard tattooing. But if I'm in the, say I'm at Indigo Junction, I would use the fact that, you know, if you share, you're at high risk. So, yeah, it just depends on where you are.
No worries. Thanks for that, Donna. Any other questions in the chat room? I know we have at least 3 more minutes if you've got questions. Otherwise, I'm pretty sure Donna and Jacqueline have those resources, information if you need them. They've provided the websites as well, which I think are really great resources, especially finding locations of clinic or where you can, where you can refer people, especially because I know referrals a thing, and most often there's always a very mutual talk about people who are not knowing where to go or where to get help. So that's really great.
Thank you.
Good. Thank you. Did you have anything else to add?
No, I'm done. Thank you so much, everybody, for joining and listening to us.
Thank you.
No worries. Thank you. I guess I'll just be ending the recording now as well. Yeah, for the rest of the people in the chat room, if you do have questions or anything, and we will be having, we have a recorded version of this as well if you want to go back, and you can also reach out to us or reach out to Donna and Jacqueline, and we can provide you with more information and have see, or if you want to pass it on to your colleagues or your departments, we'll be happy to help with that.
Yeah, I will add just one more thing. If anybody needs any help or assistance with treating or testing patients for bloodborne viruses and the hepatitis C treatments, you're always welcome to call and speak to our clinical team at Hepatitis WA to get some support.
Yeah.
Awesome. Now, I think that concludes our Birds and BB Bites today. Thank you so much, Donna and Jacqueline.